Hi everyone, it's Dr. Krishna here from patient.info, and I'm going to talk to you about whooping cough. Now, whooping cough is a bacterial infection. It's a really contagious infection, and it's characterized by its bouts of coughing. You get this cold-like symptoms at the beginning, runny nose, sore throat, a dry cough, and then over the next couple of weeks you sort of develop this bouts of coughing. So you might have complete relief between the bouts, but those bouts are pretty distressing, and what happens is it's just continuous coughing. So you cough, struggling to breathe in, so you make that characteristic sound, which is that whooping cough sound, and it can be quite distressing for the patient but also for those watching as well to help you. So then what can help is things like antibiotics, but best cure is prevention, right? It's vaccinations in the UK are available to children. It's part of the immunisation schedule, and also it's offered to pregnant women as well. Now, although the bacteria will go with the antibiotics, unfortunately, because it irritates that lining of the airways, that cough can persist, and it can last for a good 3 months, if not a bit longer, which is why it's known as the 100-day cough. Now, if you want to read more about it, head over to patient.info. But as usual, take care of yourselves and speak to you soon. Bye.